So we aim to people over 65, frailty in the community, people who need a little bit more support. For the paramedic side, we can do interventions, assessments, blood pressures, making sure they're okay and safe. And then the OT part is home adaptation and look at ways you can stay fully at home and probably avoid future falls.
Because we've got direct access into the council, whereas ambulance staff would usually think they were unsafe, we can either get them into a safe place or get things in to enable them to stay safe or get carers in, whereas normally they would go off to hospital just kind of not to be treated medically, but because they wouldn't be able to manage at home on their own.
He was taken into hospital with aspirating pneumonia, and then he caught hospital-acquired pneumonia, and he ended up being in hospital for 7 weeks. So obviously all his muscle strength went, and when he came out he couldn't walk, he couldn't sit up, and obviously with the help of the reablement team all this has progressed unbelievably. They've come out ever since, and obviously without them we wouldn't be where we were today.
At Life Rooms you can self-refer, so you can come here, and I met a Pathways advisor, and the Pathways advisors can help you with anything. Literally the phrase that we're here to help couldn't be more true than Pathways advisors, because you could ask help with what, and the answer is anything. If you want help, they're here. They will guide you to so they might guide you to other services or other programs. There's 100 odd agencies that come into Life Rooms, and they can guide you to an agency that might help. So whether that be with housing or benefits, or if it's poor mental health, or if you have Asperger's, they can refer you to the right things. But they can also refer you to courses they offer here at the Recovery College.
I mean, I have schizoaffective disorder, and I can't talk about that really in the outside world, but I can come here and it's like talking about your broken leg. You know, it's normalised, and I think it's the fact that you're not celebrated for having these difficulties, but you know, you're kind of supported, you know, in a way that you just don't get anywhere else. You make friends, you know, you make contacts, you know, it builds up your self-esteem and your confidence. It empowers you to believe that you can actually succeed in life despite the fact that you've got a mental health condition. I think that's why it works so well.
So I was in the hospital and someone mentioned the Highfield Centre, which is like brilliant for me because I had such a bad time at a hospital, and I thought being in a birthing centre, just me on my own, was more of a calming environment for me. I thought it'd be nice to experience something different than the hospital feel. So I come to see the midwife for my checkups here, and she comes to the house as well. And then they do coffee mornings as well. So you get to know the midwives, and before you're going to have your baby, so you get to know each midwife. Makes it easier coming to all one place instead of going here, there and everywhere. You get to see your midwife, and you get to come to groups and meet other people, and they're all from the same area.